We need to treat, the system as a whole rather than considering some of the scheme, like for example the health insurance scheme, the community-based health insurance scheme. But I think we need to comprehensively kind of look into the health care financing, what is coming from the domestic resource, what is coming from the external resources, and try to strengthen the system as it is, rather than considering some of the programs and also the schemes. Like for example, we have in Ethiopia two schemes, one for the social health insurance scheme and the other one is for the community-based health insurance scheme. So while we are supporting the government of Ethiopia in strengthening the healthcare financing, we should not target either of these schemes, rather to develop an IT platform that will help the government of Ethiopia to facilitate claim processing, whether it is coming from the community-based health insurance scheme or from the social health insurance scheme. So we need to look at it comprehensively rather than supporting the other way. Quality of data is not actually, it's not only the case of Ethiopia, it's in every country. I think we have been also discussing the issue in this ring as well. What can be done in terms of addressing the data quality? It should be based on the country context. The way we are working actually with the Ministry of Health it's not only just EU, but as a development partners, we are trying to to get the different data generation mechanism to be a platform that need to integrate the different sources of data, so that we can see triangulating the different data sources, and then I think that could be discussed at higher level. So like for example, in our case, we have this DHS, the Demographic Health Survey, and we have also the HMIS. In some cases there is a different kind of figures that's coming from the different source of data, but I think there need to be a kind of complementarity between these data sources, and a kind of triangulation will be helpful while we are actually thinking in the future. I think for the shorter term, we are trying to triangulate with some kind of assessments that are being conducted, like for example the SARA, service availability assessment, and also the service provision assessment that are being conducted annually, will help to triangulate the HMIS, and also the DHS is also being considered as one of the reliable source of data.